The American Medical Women's Association has been around for about 109 years. 10 years ago, our executive director was looking at different things going on with women physicians and met up with Catherine at her studio in New York and thought maybe we should have a committee at AMWA to encourage the arts. From our committee, other art groups, the literary group, music groups have also arisen over the years, but we were the original.
AMWA is way ahead by doing the artist in residence idea because it does bring something different to the medical arena that you will miss if you just study science, the textbooks.
Meet monthly and encourage our women artists.
One way an artist can get better is by interacting with other artists, and that's why we have the Artist in Residence Award.
This one is part of the series that I studied for Studio AMWA when I was studying this series called Silent Heroes, highlighting all those different people helping us. They are essential for the work we are doing.
I like how the book fades into the background. There's just an interesting texture to the whole painting.
Of all your silent heroes, who was the most meaningful to you?
In the operating room, we seeing nurse putting all the instrument and making sure that everything was ready for the surgery.
What an evolution throughout the time that we have known you.
Finding that group and having I would say the license to be a physician and also to be an artist was really instrumental in my development. Thank you for creating this group.
Ella and Kness is our artist in residence for this year.
This is actually a painting that I did of a digital rendering. With this one, I really just wanted the greens kind of all be within roughly the same color scale and have the yellow stand out.
We rendered all the way from yellow greens to the blue greens. It's really a nice analogous scheme.
A lot of my other art is digital art about women's bodies. And so I thought mixing, my art side with my medical side, doing women's bodies in different positions. It's more indicative of the way people live.
Because as you start your surgical residency, which I can relate to, when things get tough, keep art close and you'll be fine.
It's just a pterygium over the eye. It's not completely finished. This one's in pen so far, and then I'm trying to decide what to do the details of the actual growth with. I'm playing with maybe I'm gonna do really fine red glitter to do the vessels or gold. It's an ongoing series of things I find interesting while in the hospital that I'm trying to make less frightening for someone who's not in medicine to look at.
I'm in awe of the ability to make something look so realistic.
I see the interface of both the artist and the illustrator, so it's really well done.
Yeah, and don't underestimate the difficulty of drawing with a pen. You donated a piece to the Koike Museum. You gave an eye.
I started with a couple that I saw while on rotations at an eye clinic. In my actual neurology rotation, I saw a more interesting eye pathology because that's part of the neurologic exam. You have to look at the eye.
You always say, I'm really busy right now. And then the next thing on Instagram is a new illustration. What does it bring to you?
I actually get a lot of joy out of it. So even though I'm studying for step 2 and whatever else is going on right now, it's something that I would be more stressed out, not as happy if I wasn't doing it.
Why do we all actually do this? I do it because it's a source of comfort for me.
Oh, absolutely. I would come home and it would be late, 9-10 o'clock at night, and I would head into my arts and craft room to just create something. As we take the time to do our art, to draw or write or, explore some of these things, it helps us to be better observers of our patients.
Doing something outside the box makes your box bigger.
I welcome people to come to the AMWA Doctor's site online and visit the gallery.
art we trust, in women we trust, in women artists we trust.